Good afternoon. At the outstart, I would like to thank you for joining the MTA webinar. My name is Gilliam Elliott, the Outreach Coordinator for the MTA. The MTA is a global trade association in the medical tourism industry. We touch hundreds of thousands of healthcare providers, insurance companies, government buyers, and individuals in over 100 countries through our educational platforms such as Medical Tourism Magazine and medicaltourism.com and our health and wellness travel guide. I hope you will join us November 3rd through the 5th at Caesars Palace in Las Vegas for the 6th World Medical Tourism Congress and witness firsthand the opportunities and spirits of collaboration of global healthcare community. Our presenter today is Jonathan Edelheit, CEO and founder of the MTA. John Edelheit is one of the world's leading experts in medical tourism and one of the first individuals to implement medical tourism in both self-funding and fully insured health plans. Mr. Edelheit also is editor-in-chief of 4 of the leading healthcare insurance, healthcare publication and board of directors of the Global Benefits Association. He works with large multimedia employers. Please welcome John Edelheit.
Thank you, Gil, for that introduction. Good morning, good afternoon, and good evening, depending on where you are in the world. We're going to be covering today in today's webcast, medical tourism facilitators, the good, the bad, the unknown. So some of the topics we're going to cover is, how to develop markets as a medical tourism facilitator, how to build trust and credibility, identifying reliable providers, understanding complex arrangements in medical procedures, reducing the chance of error and increasing positive outcomes, sustainable operations, continued education and networking, and serving as responsible industry ambassadors. So this webcast is really for a couple different types of attendees. Those that want to become facilitators, those that are facilitators, and those companies or organizations that might want to work with medical tourism facilitators. So we got a lot of content to kind of cover in the next hour, and this is a very, I would say, comprehensive topic. This is something that I could probably present for 40 hours straight on all the nuances of facilitation. So I'm going to try to do more of a 10,000-foot approach and really an overview of it. I don't think we really need to go into a lot of the details, but I'm just going to cover some of the basics about medical tourism. It's obviously healthcare consumers traveling. It's domestically, it's internationally, it's for healthcare services, and the driving factors are affordability, accessibility, or availability. And it's really people traveling from one country or city to another. Everything that has to, do with it. I know, it includes quality, perception of a destination, and the 4 factors of affordability, accessibility, availability, and quality is you take that plus the perception of the destination, and that equals the value to a potential healthcare consumer over why they're traveling for care, because they all have their own different motivation. So if we look at who are the customers are obviously healthcare consumers, but there's really 4 categories of who those are, and that's a cash-paying patient, a government paying for a patient or healthcare consumer, an insurance company, or an employer paid. So obviously cash-paying, a lot of those patients, there's really 2 segments of the cash-paying patients. You have the ones that affordability really matters significantly to them because they're paying it out of their own pocket. And then you have the people who are extremely rich and affluent who they're willing to pay, and they don't care what the price is. They're willing to pay for the best quality and outcome. You have employers, governments, and insurers, which we kind of group all into one category, almost like corporate or government payers that will be paying for their insured or the covered people to actually travel for care. So if we look at the patient profile, of who's traveling, why they're traveling is we're still really seeing 2 trends: domestic and international travel for medical care. And I think it's important to recognize it's not always about cost. I think some people say that medical tourism is all about cost, and that's not really true. People are going to travel to where it's safe and where they believe in the quality and the infrastructure of the destination. They're not just going to travel because it's the cheapest care possible. If that hospital is in quality, if the doctor is in quality, they're not going to take that risk. And also the same thing goes that tourism, plays a major role, and people are only going to go where it's safe. So I know we're seeing, currently in the news now, a lot of turmoil in certain countries that have medical tourism, and just because it's quality doesn't mean people are going to travel right now, because if there's any internal strife or issues going on, people are going to wait to go there. They want to feel safe when they travel to a country. And I always use the alternative example of, I always ask this when I'm presenting at conferences, and that's, if you knew that you could travel to a specific country, and you don't know what that country is right now, but they have the most advanced hospital in the world. They have the best technology. They have the best surgeon for a heart procedure or transplant, and that you knew you had a 10% better chance of survival if you went to this specific country than if you got it at home, and the cost was the same, would you go there and get that surgery done, knowing 10% better chance of survival, better hospital, better doctor? So almost everyone says yes, which I'm sure many of you are saying right now, yeah, that sounds pretty good. But then if you say, okay, well, if that hospital and those doctors were located in Mogadishu, Somalia, would you go there? And the answer then all of a sudden changes to no, because it's not just about quality and cost, it's also about tourism and the perception of safety of that destination. So when we look about this slide, it's not always about cost. So, does everyone here know the person on the left, who that is? I think he's probably one of the most famous people in the world. That's Steve Jobs. And he was a medical tourist. He is so rich, or I'm sorry, he was so rich, that he could have built the world's biggest and best hospital in his backyard next to his home. And he could have brought in the best surgeons and technology to treat his cancer. But he didn't. He actually went overseas for cancer care. And I know that in the end, in his memoirs, he had actually stated he wished he had gone earlier, that maybe he could have had a better outcome or results. If we look at the next person in the middle, I don't know if any of you know who this is, but this is the famous TV actress Farrah Fawcett. She also traveled overseas for cancer. And then I'm sure everyone has to know this third gentleman over here on the right, another famous medical tourist, and that's the late Hugo Chavez from Venezuela. And, when he needed medical care, where did he go? He went to Cuba. He could have gone anywhere in the world. He had the money, he had the transportation, but he actually went to Cuba to get his cancer treatment. So, why be a facilitator? What's the opportunity? The OECD, has estimated the number of medical tourists traveling overseas between 50,000 and 60 billion. And they gave such a wide range because there's no one really tracking it. I think we all know it's significantly more than 50,000. At a conservative estimate, I would say 5 to 7 million, but probably way beyond that when we're looking at cross-border healthcare and people crossing borders in countries next to each other. And medical tourism, Deloitte in 2009 estimated that about a $100 billion industry. They had estimated by about 2017, $228 billion in medical care was predicted to leave the U.S., but they obviously adjusted that post-recession, and that was just the United States marketplace. So, the World Tourism Organization, the UNWTO, stated there was about 1 billion tourists that traveled internationally in 2012. And there's actually a percentage of medical tourists, and there's a couple percent, but it's very significant. I know that many countries have found that medical tourists actually spent about 5 to 10 times more than a traditional tourist in the local economy. So, this is showing that it has a very significant impact on tourism, on hotels, on the local economy with stores where people buy things or go out to restaurants. We have a survey we're releasing shortly that we just did this year, just about a month ago, with George Washington University. And, it found that more than 80% of medical tourists who traveled overseas brought a companion, and 60% of medical tourists, stay in their destination for more than 10 nights. Another factor with the study found that about 92% of total medical tourism patients spend less than $30,000, and that the average is about $7,417 to $15,833 per patient. Another study that was on medical tourism and wellness found the combined industries to be about a $2 trillion industry with about 5% growth. So we can understand why a lot of governments, ministries of tourism, health, and economic development has found medical tourism to be a top priority for the country, because it's a positive impact on the local economy, creates jobs, and it's global. And this is why a lot of organizations also are interested in getting involved in facilitation. So why is the industry growing so fast, and why is there strong opportunity in the sector? It's because a lot of the barriers to people traveling to receive care have broken down over the past 5, 10, 15 years. It's now affordable and accessible. You can buy a plane ticket. You can fly anywhere you want in the world to get this medical care. There's easy access to info on the web. And there's growth of healthcare and wellness clusters that are promoting themselves as a destination. And people are going online now and researching for their medical condition, who's the best doctor, what's the best hospital, where is it located, and how much does it cost, no matter where it is in the world. This is a little chart on the stakeholders to show how big this industry is, and all the moving pieces that are involved. Because if we look at it from all sectors, if you've got the medical providers, the hospitals, the doctors involved, and the tourism side, airlines, hotels, travel agencies, transportation companies, tour operators, facilitators, ministries of health and tourism and promoting entities, healthcare clusters, chambers of commerce, associations, universities, quality accreditation, and then you've got the actual end user who's paying for the procedure. So there's a lot of moving pieces, and all the pieces have to move in unison, and all the pieces have to move right, because if a patient has a bad experience with one aspect of it, that ruins the whole experience. If they have a bad experience with the hotel, ruins the whole medical tourism trend. Same thing with a tour operator or a facilitator or a problem at the hospital. So everyone kind of has to come together and collaborate and work together to ensure a positive patient experience. So if we're looking at what procedures they seek, I think most people understand the procedures. It's hip, knees, back, and spine for orthopedics, cancer, heart, transplants, dental, bariatric, alternative medicine, stem cell, cosmetic, infertility, rehab. There's a lot more procedures that aren't included here, but really people are traveling for absolutely anything. Any type of procedure that's possibly available, they're willing to travel for. Now, one of the results which we haven't published yet from the study we just did with George Washington is, this was a certain segment of patients, medical tourists, so I don't want you to think this is a global perspective of it, but it found about 25% went for dental, 25% for orthopedic, 9% for bariatric, 8% oncology, and the other was about 33%. Now, one of the biggest markets that I see growing in the future is dental tourism. I see this really growing and being a great revenue source and market for facilitators, because there can be significant savings if people are traveling. There's significantly fewer liability and quality issues. When you're going for a medical procedure, there's all kinds of complications can happen. Some of them can be very negative. When you have a medical procedure, complications happen. There's nothing you can do to stop complications or guarantee they won't happen, but someone could pass away. They could have a heart attack, or the procedure could go wrong. And then you've got to deal with, well, who accredits that hospital and what's the quality of the doctor and hospital. But when we look at dental, you don't have those issues. You really don't. I mean, yeah, it's quality, but it's a lot easier to deal with, and you don't have the liability. No one's going to pass away from getting a dental implant. And it's very easy to combine a vacation with dental treatment. They go really well together. And you're seeing a lot of people traveling for dental tourism from developed countries to less developed. So you see a lot of people going from Western Europe to Eastern Europe. I know Western Europeans love going to, for example, Hungary for dental care. You see a lot of North Americans going to Latin America for dental care. And that's going to continue. People are always going to look for lower costs. I know, for example, if we look at North America, it can be 50 to 90% less for getting a dental implant overseas than in the United States. And those can be expensive. Depending on where you go to get your dental implants, it can cost anywhere from $20,000 to, I've heard it being as high as $75,000, depending on how many dental implants you need. So having that significant savings is going to make a huge difference going forward. So if we look at, medical tourism facilitators. They really guide the patient through the process of securing and achieving quality and affordable treatments and procedures at attractive destinations both internationally and domestically. And they provide a real value. They're the person who handholds the patient and guides them through the entire process. And it can be pretty intimidating for a patient to try to figure these things out on their own. So who wants to be a medical tourism facilitator? I think we realize that few children, when they're little kids, dream about being medical tourism facilitators. What do kids dream about? Being athletes, being a lawyer, being a doctor, being president of their country. But obviously, as they mature, we're seeing the numbers grow, and we see a lot of people entering the field of being a facilitator. And they're important because the facilitator works with the patient, the doctor, the tourism organizations, and aftercare providers. So facilitators come in all shapes and sizes. And, there's medical facilitators that are actually part of big multinational corporations, whether employers or insurance companies. There's medium-sized ones that have great internet marketing strategies. There's small and mom-and-pop businesses that are more of startups, or it's one or two people running the facilitation company. So if we look at some of the things, we look at individual patients. So you're marketing as a facilitator to an individual patient. You really have to segment what your market and what your business is going to be. Who's your target patient? What's your target market? You can't just say, I'm going to be a facilitator, and I'm going to be a facilitator to all the patients in the world for all the procedures, no matter where they want to go. It's too big of a marketplace. You really need to narrow it. So what medical procedures do you actually want to provide care for? And then what geographic location? So geographic location is where you're going to get the patients from, and what geographic location you're going to send the patients to. Also, it's going to be really difficult as a facilitator if you have patients inquiring from a specific market. Let's say it's North America or Europe, and you tell them, oh, I have 50 different countries you can go to and 100 different hospitals you choose. That's going to be too intimidating. They're not going to be able to make a choice. The other factors you have to think about is, from a demographic standpoint, what type of person are you marketing it to? Is it a specific age? Is it a specific race? Is it a specific religion, education, income level? You might want to be marketing to people who are coming from a developed country, who are not rich, who might be middle class, who can't afford care there, but they want to go to a developing country where care is less. Or you could be catering just to the ultra-rich and affluent, who money is no object. You could be catering to young people or old people. You could be catering to, you could be a Hispanic facilitator, focusing on the Hispanic patient and sending them to Hispanic countries. Or you could be, for example, a facilitator who decides that, I'm a facilitator and I'm in the Middle East and I'm Muslim, and I want to coordinate care specifically for Muslim patients to hospitals that can accommodate the religious and cultural customs of Muslims, because not all hospitals can. And this is important because, we've seen hospitals also, besides facilitators, go after certain markets. So I know, like, the Middle East and GCC is a very attractive market. And I know there was one hospital here in South Florida that said, we want to go after that market because in the Gulf Coast countries, they spend a tremendous amount of money for care. They want the best care possible. They don't care what it costs. And so they went after that market, and they started bringing patients to their hospital here in South Florida from the Middle East who are Muslim, and then they all of a sudden realized that they didn't have the infrastructure, the staff, training, or service to accommodate those cultural and religious needs of the patient. And so they actually had to cancel the program and discontinue it, where there are hospitals in Thailand and other countries that do have all the services. They have separate floors and wards, for people who have specific religious and cultural needs. So it's not something you can just turn on and off. There's a cost, there's investment, there's infrastructure, there's training that has to happen. Other psychographic things that you have to focus on: what's the value of the patient? What's their interest? What's their attitude? What's their lifestyle? What do they want to be doing? What does the companion want to do? So if we look at, I think one of the most important things is, how long does it take? You have to look at how long it takes a product or service to get to market. And what I mean by that is, you have that marketing time frame of when you go out and start marketing a product or service, of how long it takes you to start getting those sales. Does it take you a week? Does it take you a month? Does it take you a year? So you have to really look at how long of a sales process do you want to be dealing with, and that will determine, do you want to go after the healthcare consumer who's cash paying, the fully insured, insurance company, the self-funded employer, the government. With government-funded insurance, I know there's some issues where where governments haven't paid, literally haven't paid in a year or two for their patients, and hospitals cut off that specific government where they can't send them patients anymore, and then the government just shifts to a new hospital. So government business, while it can be attractive, it can be problematic, and there are actually hospitals that won't work with specific governments in different parts of the world because they know they actually, aren't going to get paid. So if we're looking at fully insured and self-funded, it's the corporate market versus on the right, the individual. So the corporate market is heavily relationship-driven because you got to build a relationship with the employer or insurance company. It's a much smaller target market, but it's a longer sales process. You're not going to go to an employer or an insurance company and say, hey, implement medical tourism, and next week or next month you're sending patients. You actually have to go have meetings. You have to convince them. Once they decide to do it, it has to be implemented. It has to be educated to be insured through different communication channels. And then the actual end user, that healthcare consumer who's insured, has to have that medical situation happen where they need a procedure. So it could take a year. It could take 2 years, for you to start getting business from that specific market where patients are actually traveling. And I think you've got to deal with multiple decision makers and a lot of face-to-face meetings. I think the biggest challenge for the corporate market is a total lack of education, meaning that what I've seen in the past is medical tourism facilitators who, they go to the employer, they go to the insurance company, and they say, medical tourism is amazing, it's awesome, the quality is great, implement it. And there's no backup, there's no education for the end user to really get them to believe and trust in the care and want to travel. And so a lot of the employers or insurance companies kind of say, not interested, we're not going to implement it. And then what I've seen with some of them that have gone forward and implemented it, that facilitator that they're partnering with or the insurance company are doing no education. They're just telling employees once, or maybe not at all, this medical tourism option is now available to you, and that's it. And the reality is, this isn't like buying an iPhone, buying a new car. This is healthcare, and this is getting on a plane and traveling to another city, region, or country for care. And for that, you need to over-communicate, over-provide the information about the quality, the hospital, the doctor, the outcomes, the risks, so that patient, that healthcare consumer feels extremely safe. And I think this is one thing that has really held back the industry growing even really significantly and much faster than it really, it should be growing a lot faster than it is, but it's this lack of education. And it's not just the facilitator or the insurance company, it's even the hospitals and even the governments who are promoting medical tourism. I have not really found many governments who really understand how to educate consumers, and they're educating consumers. Instead, they're spending their money on things that they might not see a return on investment. They're doing, let's do a familiarization trip. Let's bring 30 or 40 buyers of healthcare over to our country and let them do a site tour of their hospital. Well, that's great, but what have you given to those facilitators or those buyers of healthcare to convince them of the care so when they come back, they can really market the country? What are you giving to them to give to the healthcare consumer, their end client, the patient, to convince them to travel? There's none of that education being done. I know that on the Medical Tourism Association side, we're trying to deal with those challenges through education. And we came out with about a year and a half ago our healthcare travel guides, and we're trying to really work on more educational content that can be aimed and given directly to the consumer, and which costs no charge. No one has to pay anything to access that information. So on the individual side, obviously, it's extremely service-driven. It's a much bigger, larger target market. It's shorter sales prices. Buying decision includes price, desire, quality. There's usually one or two decision makers, the patient and their spouse. And a lot of times we're finding that the wife or the female is the one making the decision on where that patient should go. And communication is typically done by email and phone. And there's not really the face-to-face meetings that happen in the corporate market because you're dealing with patients that can be anywhere in the country or the world. So what are the revenue models for facilitators? There's really three different models. There's the percentage model where you're getting a commission off of the patient's care. So if the procedure is $20,000, maybe you're getting 10%, maybe you're getting 15%, and the average is about 10 to 15%, but we've seen it go up to 20%. You know, if it was $20,000 and you got 10%, you'd be getting $2,000. There's a fixed fee model where the facilitator is charging the patient a fee. It could be $500 or $1,000, and they're not taking a percentage. And there's also for the corporate market a per employee per month, where maybe you're charging an employer, an insurance company, a fixed fee that happens every month for each employee. So it could be 50 cents, it could be $1, it could be $2 per employee. So if they have 1,000 employees and it's $1 per employee per month, it could be $1,000 per employee per month, or $12,000 per year. And then, you know, depending on if you're dealing with an insurance company or employer, there's ethical things that can come up that can really depend on the corporate partner you're working with, because they could determine that they're happy with the commission model, or they could determine we don't want to work under a commission model as an insurance company or an employer, because we feel like then there's an incentive and potential pressure to convince employees to travel because the facilitator needs to make their revenue through the percentage. So they might just want a fixed fee or a corporate per employee per month fee. Also, we're seeing facilitators are also getting commissions on lodging and tours. You know, the hotel and tour operators, they're getting special deals with them. Another area that I see as a huge area of growing trend going forward is domestic medical tourism. And this is really healthcare consumers traveling regionally, not leaving the country, but wherever they are traveling regionally. So I know in the U.S., for example, there's been some studies, and one of them found that it's, you know, expected that in the future, 40% of employers over the next couple of years may implement domestic medical travel. So if we look at domestic medical travel, that's really people traveling from one place to another. So if I'm in Miami, Florida, I might travel to San Diego, California, because there's an amazing hospital there, and either the quality is better or the cost is better. Or if we look at Europe, it could be someone going from Germany to Hungary, or, you know, it could be someone going from Croatia to Switzerland. So there's all kinds of cross-border healthcare in Europe. And I think what we're going to see in the future, we're definitely going to see in the future, is the cross-border healthcare initiative takes place in Europe soon, and Europe's going to be one of the biggest regional hubs for domestic medical tourism, because people will be able to travel anywhere within the EU and get reimbursed for care. So I'm from Spain, I can go to Portugal for my medical procedure now. I'm from England, I can go to Germany or Switzerland or Austria. So it's really going to open the door for a tremendous amount of medical travel, and I think it's also going to open the door for a race where we're going to see a lot of healthcare providers marketing themselves, investing in technology and medical equipment in their facilities to really compete under this cross-border healthcare. So how do you get started, you know, in medical tourism? I mean, there's a lot of details and things that you need to do as a facilitator, from even little things like helping patients get passports and visas and explaining the process, because they may never have had a passport or left the country, assisting them with, you know, flight and lodging accommodations, transportation there, recreational therapy, sightseeing tours. But I think that, you know, some of the key factors that, you know, one of the most important ones, you have to identify reliable healthcare providers. You have to work with top hospitals that are accredited and the top doctors. You need to understand the complex travel arrangements and medical procedures that are involved, because you can't just let everyone travel for care. They should usually have a checkup before they go overseas to see if they're even healthy enough to travel, let alone healthy enough to get the procedure. Can you imagine, and this happens, someone goes overseas and they get DVT, deep vein thrombosis, on the plane, or they go all the way overseas and there was no best practices or system put in place. The patient gets there, and guess what the hospital and doctor says? I'm sorry, we can't help you. You're not healthy enough for us to perform this procedure on, and the patient has to travel all the way back to the U.S. Other big issues that come into play is the breakdown of language and cultural barriers. You know, there's hospitals that will try to promote themselves, even though they might not speak the language of the patient they're trying to attract, or they don't have the cultural experience and training to deal with them. And what does that lead to? That leads to a bad patient experience. So I think one of the most important things for facilitators is really creating a sustainable long-term business plan. And so what I'm going to talk about next is really marketing and brochures. So you can't just build a beautiful website, build a beautiful brochure, and just assume that patients are going to come. Like now you've opened your door, everyone's going to come. You can't just send emails to corporate buyers and assume they'll send patients. Myself and also other people I know in the industry who they might work for employers or insurance companies, they'll get these canned emails that'll come in through Outlook or sent through LinkedIn. And it's an email of saying, a very long email of this is our company and, we're, for example, in such and such country in Asia, and we do medical tourism, and we have amazing service, and we can handle all your patients' needs and all your procedures, when can you send us patients? That's not the way it works with corporate buyers. You can't just send somebody an email or a LinkedIn message and just assume they're going to send you patients. It's never going to happen. So I think it's setting the reasonable expectations and understanding how to market and how to market effectively. So I think the other important part that goes along with that is an attitude or philosophy of I don't need to travel to meet potential clients if I'm meeting with corporate buyers. If you're working with healthcare consumers and cash-paying patients, that is correct. You don't need to travel to potentially meet your individual clients. If you're working and trying to go after the corporate buyer market, you absolutely have to travel and meet your potential clients. This is an industry that's about the long-term business relationships. You can't just invite, if you just think about it, you inviting someone from across the globe to take a scary trip for healthcare. And I say scary trip not because medical tourism is scary, but if you're telling me that I'm from Germany and I have to go to Singapore for a heart procedure and, I might die from it and I've got to be away from most of my family for it, that's scary. And you got to have what I call healthcare trust. And that's a big thing I think a lot of the industry is missing is this healthcare trust, where it's educating the individual and the corporate buyer on the quality of the healthcare, the doctor, and why they're in trusted hands, and they don't have to worry. So you can't build healthcare trust by sending an email or a LinkedIn message. And to give you an example, you have to get out there. You have to go out and meet people. You're not going to grow your business by just, in this industry, dealing with corporate buyers by picking up the phone and emailing. And the reason why is these corporate buyers, they do travel to conferences, and they're going to work with somebody that they've met with in person, whether they've met you at a conference, whether you've come to their office, whether they've come to yours. That's who they're going to work with, people that they've met and they've built a relationship with. The biggest thing that I can drill home is this is a relationship-driven business, and it's a long-term business. And don't just think just because you're a beautiful website brochure, everyone's got a beautiful website. Everyone's got a beautiful brochure. Everyone can send a nice email. So how are you really distinguishing yourself, and how are you building that relationship? It's key. The other part of it is internet marketing. So I know in the past, a lot of facilitators spend a tremendous amount of money in search engine optimization. And this has been a big push, SEO, you got to do SEO. It's the only way you're going to get patients. But for those of you who aren't aware, now there's a Google Panda, which is their new algorithm for search engine optimization. So, what a lot of the experts are saying, and what this is, Google doesn't come out and say this is how our algorithm works. They make people figure it out. But what most of the experts are saying is the new Google Panda algorithm almost penalizes for search engine optimization. And what I mean by search engine optimization, there's all these terms out there, the black hat tactics, and all these tactics which are considered not good SEO tactics, that a lot of business people don't know that if they outsource to their search engine optimization company, maybe they're using these black hat tactics where they're doing what are called backlinks. So they're going online and they're finding like 1,000 different websites and trying to put links to that website to yours, or doing other SEO tricks. So basically, the new Google Panda algorithm is supposed to, what it's supposed to do is it's based upon the real content that you're providing. So all the experts are saying all that SEO stuff that happened over the past 10 to 15 years, it's not going to exist anymore. It's not going to matter. It's being phased out, and it's going to be about what content and education you have on your website. and how often you're updating it. It's not going to matter about what links you're putting there or how you're trying to drive traffic to your website. So this means you really have to reevaluate what's your internet marketing campaign going to be to get patients, because when you're dealing with consumers, you really got to focus on internet marketing. So you can buy leads. I know there are companies that consolidate medical tourism, healthcare consumer leads, and then they sell them. The only challenge with buying leads is you might be buying a patient from Canada who's looking for a knee replacement, but with that lead, it's been sold to 10 to 20 other facilitators. So is it really a quality, good lead? There's advertising on Google, and that can be very effective, but I know it's gotten very expensive. I don't know what the pay-per-click right now is in medical tourism, or if they're at 5 or 10 or 15, but as more people are trying to compete to advertise on Google AdWords for people looking for medical tourism, that means that's going to be very expensive. So some of the other important things about, on the facilitation side, I think one of the least talked about points is privacy laws. And you really need to understand the privacy laws of the healthcare consumer and customer and what country they're from. So for example, in the United States, there's a law called HIPAA, which is the Health Insurance Portability Act. And this dictates the privacy of medical records and other things for patients from the U.S. There's SOPA in Europe. But what I've seen in the past is not a great understanding of the laws, of what they mean, how to conduct business under them to be safe, and even where people are misspelling it. They're misspelling it on their website. They're misspelling it in presentations. So really, these laws are not that difficult to understand, to know how they work, to how to comply with them. So you should take that time, because if you're out there and you're emailing someone or you're doing a presentation or on your website, you have a misspelling in a privacy law, all those patients or corporate buyers from that country are going to know they're going to think, and it could just be a typo by your web programmer, but they're going to think that maybe you're not a quality organization, or you don't understand the privacy laws, or you don't really comply. And then there's companies that misrepresent compliance, that say we're HIPAA. There's one person in the medical tourism industry that's always extremely vocal, talking about how they're such a big company and how they do everything right. And every time they post something online, they're building up their company on a constant basis, and themselves. And we had a patient who came to us for help because that facilitator was dealing with them, and they were a cancer patient, and they asked for help because they had problems with that facilitator, and they sent us all the information back and forth between that facilitator and sending them their medical records and other challenges they had. And what happened is that facilitator, who has actually gone out and said they're HIPAA compliant and talk about how other facilitators don't follow privacy laws, they told that patient, it was a U.S. patient looking to go to Europe for cancer care, can you please send your medical records to me through Dropbox? I'm sure a lot of you know who Dropbox is, but Dropbox is not qualified as a communication tool that's secure and private for any country's privacy laws. For HIPAA here in the U.S., for SOPA in Europe, it's an insecure method, and those person's medical records could be stolen. So other things, do you have a liability policy? Do you have a patient waiver? Is it good? I mean, things have gotten better, but we still see facilitators that have no liability policy, or they're telling people they do when they don't. They're not having patients sign patient waivers, or the patient waiver is not good, and it doesn't have all the real legal language that it needs in there for the specific country the patient's from or the country they're going to. And obviously, for those of you who aren't aware, the patient waiver is what they sign, basically saying they waive liability, they assume the risk of traveling overseas, they won't hold the facilitator or the hospital liable. They understand the quality, they understand the legal recourse in that country. So having a really solid patient waiver is important. Does your contract, with the hospital, if your facilitator protects you, or is it very one-sided? And another piece is, as a facilitator, is the facilitator vetting the doctors? Are they choosing the doctors, or are they letting the hospital choose the doctors? There's another chance, of things. We get, we're really there to educate all the industry participants, the buyers, the hospitals, the governments, the facilitators, but we do a lot of consumer education, the MTA, and we're really expanding and investing in our consumer education going forward through videos, through our webcast, through our travel guides, through our magazine, through medicaltourism.com. So what ends up happening is we end up getting the consumer complaints. And I would say a majority of, probably 90% of complaints we've gotten from patients who had a negative experience or a bad outcome are coming from facilitators in hospitals that are not members of the MTA. Now, that doesn't mean we still don't deal with the issue, because we do deal with the issue, because we're the only ones out there that really can do anything about it. And so what we try to do is we try to come in as a neutral intermediary and try to advocate for both the patient and for that hospital or doctor, and see and create the dialogue to see if there can be a positive outcome, if the both can resolve it. Because usually when it comes to us, if the patient's upset, they're going to go to the media and press, and the doctor or hospital is at an impasse. And some of it is just because they're not communicating. It could be, we've had cases where the hospital or doctor just did something very wrong, and they have just stopped communicating with the patient. They don't want to take responsibility, which that's putting your head in the sand. It doesn't make any sense. And sometimes the patient just want to hear someone listen to them and about their problem, and they might just want a simple fix. So it's really getting that dialogue going between the hospital and the patient. But we had a situation years ago with a patient went to Mexico for bariatric procedure, had a very bad outcome. I won't go into all the details, but there were issues with the patient's medical records being conflicting and other things like that. Now, when we talk about, are you vetting your doctors or letting the hospital choose, what was uncovered there is that the doctor who performed the procedure, I'm not saying that they weren't chosen because they were the best doctor, but that doctor just happened to be the brother of the person who ran the international patient department. So is there a conflict of interest there? Was that doctor chosen for the right reasons? And did the facilitator involved, did they know that, and were they involved in the process, or did they just assume that the hospital is choosing the right doctors? And so the whole point of this is just to say, as a facilitator, or even as a corporate buyer, it's your responsibility to vet the doctors and make sure you are working with the right doctors, that they're credentialed, that they're the best options they have available. So, obviously facilitators are industry ambassadors, and they can make a difference in a patient's decision to travel. They're the face of the industry. They're out there promoting it. So does it sound easy to be a facilitator? It's not easy. Besides all the issues involved, some patients have limited access to care. They don't have health insurance. They have a problem putting together money. Some patients need immediate care. A lot of patients are afraid. I think one of the biggest services that facilitators provide, which is an amazing and awesome service, is they hold the hands of the patient. They're like that good friend or that loved one or companion who can really listen to that patient's needs, listen to their concerns or fears, and help them get over it. And facilitators usually spend a lot of time with patients and build a real bond with that patient. So some of the things, obviously, a facilitator needs to be concerned with is quality and liability. Obviously, work with an accredited hospital. Focus on limiting your risk of liability by getting a patient waiver, having liability insurance, making sure you're working with the best hospital and doctor. If you were to say, what's the most important thing for quality and reducing your risk, while quality accreditation like a JCI or another is, really extremely important, I would say the best one is working with that best doctor and hospital. If you have the best surgeon who has the most experience, the less amount of complications, and the best hospital, that's going to reduce any type of complications, any negative outcomes. That's your best guarantee. Just because something is quality accredited, and I think this is where there's a misperception in the industry, accreditation, just because someone's JCI accredited doesn't mean that they're an amazing hospital with the best quality in the world, and they don't have bad experiences. The Joint Commission International is a subsidiary of the Joint Commission in the U.S., and the Joint Commission in the U.S. accredits most of the U.S. hospitals. Well, there are hospitals in the U.S. that are Joint Commissions accredited that you don't want to go to as a patient. You don't want your loved ones going to. that they have reputations that if you're, an older person and you have to get admitted to that hospital, that you might not make it out. So people shouldn't just focus only on, oh, it has the seal of quality accreditation, therefore everything must be amazing. And there are, at accredited hospitals, there are doctors that are excellent, there's average, and there's poor. So you really need to vet the doctor. Now, if we look at healthcare reform as an opportunity, so I'm going to just examine the U.S. real quick. I could go on for a week about really breaking down the law in the U.S. with healthcare reform, but Obamacare, as it's called in the U.S., is going to be really positive for both domestic medical tourism and international, with patients within the U.S. traveling within it and outside the U.S. Because there's a lot of misinformation about the law, and this is not taking sides, Republican versus Democrat. The reality is costs are going up. It was kind of kept very quiet for a while, but costs are significantly going up. And I was talking about this back in 2010 after the law passed. I did some medical tourism webinars. I did some white papers. There were people in the industry saying, oh, healthcare reform, no one's going to travel under healthcare reform anymore. It's free healthcare or free surgeries, or there's going to be less people insured. And I said, no, that's not the case. 3 years ago, I was saying costs are going up, they could double, and that more people might not have insurance anymore. So for those of you who haven't really been staying in tune, over the past 2 to 3 months, what everybody has known for 3 years, they're finally starting to report on. The insurance companies have come up and said rates are significantly increasing. Democrats who voted for the law said the law has a tremendous amount of issues. It's something needs to change. And employers are doing everything they can to get out of the healthcare reform law. They're taking full-time employees and making them part-time, so they don't have to offer them insurance. They're turning them into 1099 independent contractors. They're hiring temps now. Walmart's starting to hire temp employees instead of full-time or even part-time, so they don't have to offer them health insurance or pay the fine. So there's this massive movement going on in the health insurance industry of everyone looking at every single way they can avoid offering health insurance to people. And so we're going to see more uninsured people, more treatment delays, and more employers getting creative. And with that, there's healthcare reform going on all over the world. So it's not just the U.S. Every single country in the world is going through their own healthcare reform. So really, depending on the target market you're looking at, you really want to look at what's going on with their healthcare reform and how that's going to impact medical tourism business coming from that country. So if we come back to employers and insurance companies, a huge trend in the future, which is really going to take off, is global health insurance policies. And one thing that I'm really excited, to announce, and I wish I'd added to my PowerPoint, but putting it together is it just popped in my mind now. We're going to be doing a press release, and we're creating some very innovative partnerships with global health insurance companies. So we signed the MTA signed a multi-year agreement with I think the biggest global health insurance company in the world, and they're going to start hosting within our conference their own conference each year. So there's going to be a press release, I think, that's going to go out the next day or two, and we're going to be expanding that and bringing more health insurance companies within our conference in more of a long-term partnership approach. And so what's happening with global health insurance, and why does this tie into medical tourism, is most of the policies that are being developed out there are global policies that offer a travel benefit. So you can buy 3 different types of policies. You can buy a local policy, a regional, or global. So let's pretend I'm in Dubai or the United Arab Emirates. So I'm in Dubai. I can buy an insurance policy that just covers me in the United Arab Emirates. Or I can pay a little bit more and get a regional policy that covers me in the Middle East and Gulf Coast countries. Or I can really pay up more and buy a true global policy that allows me to travel anywhere I want in the world. It's going to cover my airfare and my medical procedure. This is where the global health insurance policy comes into play. This is the trend. This is where everything is headed, which means that global health insurers are going to be the biggest senders of patients around the world. And as more and more people demand these policies, the more middle class, more upper class people are emerging in developing countries, we'll see more people travel. And so it's not just partnering with that insurance company, it's getting to that policy holder, the person who has insurance, and getting them to understand the benefits of why they would want to travel to a specific hospital in a specific city in a specific country. So it means you have the opportunity to get patients from anywhere. Another big area that's overlooked is this expats, expatriates. I've been shocked at how many of the majority of hospitals that I've visited in everywhere in the world, and they're going after medical tourists. And I said, what about your local international patients? All the expats that are working here, that when something happens and they need a procedure or a medical emergency, they have this global health insurance policy, and they're getting evacuated or travel back to their home country for care because either their employer, or their insurance company don't understand the quality your local hospital provides. And that's a huge opportunity that are right there, that there's no travel really even needed for it. But whether they're traveling patients or they're local expats, they're all international patients, and they need special services and care. So, some of the challenges on the global health insurance side is if you're a facilitator, it's contracting with hospitals. So, unfortunately, I think one of the biggest challenges for facilitators is contracting with hospitals. You ask the question, is it easy to contract with hospitals? It's a huge no. It's a no in caps lock. Hospitals are very difficult to contract with. I've heard the stories of facilitators, spending at 3 months, if they were lucky, 6 months to a year, 2 years, not getting contracts signed. And they don't know if it's because the hospital doesn't want to work with them, or if there's just bureaucracy, or the hospital doesn't know how to contract with them. So it's been a big inhibition in really growing the industry more, because if a facilitator needs to take 6 months to a year to get their contract signed, they can't be marketing to patients. They're basically being distracted and not doing what they want to do, is marketing and get patients going. Instead, they're dealing with contract negotiation. They have a problem traveling. They don't have a budget to go travel all over the world to see all the hospitals and contract with them. So one thing we've done in partnership with the Global Benefits Association is building a global medical network and a centers of excellence and specialization network that'll be pass-through. What I mean by pass-through is a way that a facilitator, anyone can access it, facilitator, insurance company, employer. They don't need the contracts with the hospital. They'll be done through the Global Medical Network, and they will get the same price had they gone to the Global Medical Network. They'll get the same commission had they gone to the hospital directly. Everything will remain the same. That's what I mean by pass-through. It's us working to work with facilitators, insurance companies, and employers, and identifying those hospitals to add to the Center of Excellence Network, and then have it, and then allow all those buyers to be able to instantly access it. And that could be a significant advantage, because it's not just about contracting with the hospitals. You could get a patient inquiry tomorrow for a liver transplant, and they want to go to Singapore. So immediately you need to be able to access a hospital in Singapore, and you don't want to have to wait for the time that it might take a week, 2 weeks to get conversations going with that hospital. So some of the legal concerns, if we look at this slide, what are legal concerns for medical tourists, and what are best practices? So obviously medical complications. You need to have a proper waiver where they're waiving the liability, they're waiving the risk, but you're also disclosing what the medical complications are. There's no reason to hide the medical complications. This is medical care, complications happen. And I think people will trust you more if you explain the complications and try to cover them up. You need to have proper insurance. As I said before, choosing the quality hospital, choosing the quality doctor, and obviously, if you're a buyer, corporate buyer on this webinar, then it's choosing the right facilitator. So we look at what are weakest links in the chain. Facilitators who might make promises they can't keep. Facilitators who are biased towards certain healthcare providers, so maybe they pick certain healthcare providers because they pay a higher commission, or the price is cheaper, not because it's the best hospital. Running the only medical tourism association in the world, we get it all. I hear it all, and some of the stories we really don't publish. We don't go out there and blast them out there, but some of them are really shocking. A couple of years ago, I got a call from a orthopedic surgical center in California, and they said, "What do you know about this facilitator in North America?" And I give them some background of what I knew on the facilitator. And I said, "Why are you asking?" and they were a member of the MTA, not the facilitator, the Orthopedic Surgical Center. And they said they've actually asked if we could use knee implants that are cheaper and don't last as long as the implants we use. And she said, we're shocked. We use implants which we think are the best and the highest quality that last the longest, and they've asked us to use substandard things so our prices would be cheaper so they can get more patients to come. And what they basically said is, we're not working with that facilitator. We don't want to work with them. And also from a Medical Tourism Association standpoint, they would not be eligible to become a member with our association because our tenets are transparency and quality and pricing. They wanted to use a substandard implant that is not what that hospital used, and they did not want to share that with the patient as to why it was cheaper. I think it's fine if you take the approach, but I've never seen this approach anywhere. Dear Mr. Healthcare consumer or Miss Healthcare consumer, here's your knee implant that lasts 10 years and it costs 10 grand. Here's your knee implant that lasts 15 years and it's 15 grand. I haven't seen that, but if you did do that and that option was available, I think that's totally acceptable if you're transparent about it. But this facilitator wasn't. And no one benefits from this because, people get substandard care or implants, then there's going to be, it's going to be negative for the industry. There's fraud that goes on the industry. Fake clinics that facilitators set up, and they take patients' money, and the people never get the care because the clinics don't even exist in the country. And by the way, some of these stories I'm going to provide to you is you Google these stories, they're in the news, and it could be a facilitator that's mentioned in the news all the time or sometimes, and people might not even know that this facilitator does not practice best practices. They practice bad practices, focused on commission, seeing facilitators stealing money from patients. One thing we've seen is, fake buyers, where people are bringing fake buyers to specific countries, and maybe they're charging consulting fees to bring the buyers. Maybe the government is paying to fly in for airfare, or the hospitals are. And we saw this actually happen to the country of Costa Rica, where they ended up having someone bring in fake buyers, and then the person tried to go to other countries to try to sell these fake buyers. It's a very small industry, and people know things very fast. So I think it's vet who you're working with. If you're a facilitator, and someone's trying to tell you they can bring you corporate buyers, vet those buyers. You ask, feel comfortable in asking those questions to determine if they're really quality buyers and real. We're seeing people who are presenting themselves as buyers, and they're not buyers, they're actually consultants. So they're getting governments or hospitals, it could be a facilitator to fly them to do site tours of hospitals or things like that. And in reality, they're not a buyer. They don't send any patients overseas. They say they have access and they work with insurance companies and employers, and they don't. And they're getting their whole airfare and hotel paid for, and then they're going over and pitching consulting services. And it's their way, they think, of basically having all their business expenses paid for. So just be careful. There are quality buyers. There are real buyers. But unfortunately, with any industry, there's always people who try to take advantage of people. And one thing is, don't misrepresent your staff or the number of patients you have. I know there was this big facilitation operation that all just fell apart, that supposedly had all these people representing them all over the United States, and they were saying that they had sent over, I don't know, they got 1,000, 2,000 patients per, since the start of their business, and they had X number of employees. But they hadn't sent those patients overseas. They didn't have those number of employees. They were using their partner at the International Patient Department of Hospital, and using their staff numbers and the number of patients they travel. They had traveled to their hospital. So, be open, be transparent. In the long run, people are going to find out and they're going to know. So, and I think another important thing is healthcare consumers are very savvy and they can't be fooled, and people go to the internet and they talk. It could be on Facebook, it could be you know, on LinkedIn. It could be on other groups. People are going to know if you're doing things unethically. A huge market in the future for facilitators is the silver tsunami, the baby boomers. And some of these statistics are U.S.-based, but they're almost all the same for overseas. So by 2030, half of all Americans will be age 50 or older. 6 out of every 10 baby boomers will be suffering from multiple chronic conditions. By 2030, there'll be 10 times more knee replacements that'll be performed than several years ago. So baby boomers are going to put a huge demand on the healthcare system globally. Local healthcare systems won't be able to handle it. There'll be delays, expensive costs, and they're going to travel for care, whether it's orthopedics, heart, or dental care. I just read a great article today on China, and it was the same statistics. There's going to be double the number of elderly by 2030 than there are today in China. And they actually passed, China passed a new law that went into effect today that said that children have to visit their elderly parents. So now it's mandatory that you have to visit your parents because they're having an issue of how do they take care of all the elderly in China, take care of their daily needs, take care of their healthcare needs. So they're trying to force children to get involved with their care, and this is something that's happening all over the world. Another big trend that has been focused on is the ethnic medical tourism, and that is people of the same cultural background in a target market that you want to send to a certain country. So, for example, it could be Hispanic Americans going to Latin America. It could be Latin Americans going to Spain. It could be people of who are Muslim going from the Middle East to Malaysia or Malaysia to the Gulf Coast countries. So there was some research done, and they found that, for example, almost 54% of Hispanic Americans living in the United States would consider traveling overseas for medical care, and almost 57% of Asian Americans. And this is about 20 to 25% more than Caucasian or African Americans. So why is that? Is with ethnic people, you do not have the cultural or language barriers that you have with someone else. So if you're Hispanic, you probably speak Spanish. You're comfortable being in Latin America. You're comfortable with the customs, the culture. So I think this is a niche market everyone should really focus on. So we're looking in countries around the world and focusing on that ethnic marketplace and bringing those ethnic patients to another country that has similar cultural or language barriers. Now, one thing I want to address, because I think that a lot of the conversation has really stopped about saying tourism doesn't have a role in medical tourism. Because I already gave that example of, yeah, it does, and someone going to Mogadishu, Somalia, to go to the best hospital and best doctor. And the reality check is, yes, tourism has a big role. People aren't going to go somewhere that isn't safe. But there's also common sense. So this is an example of someone skiing with a cast on. You're not going to get your knee replacement or your hip replacement and then going skiing. You're not, going and getting a facelift and going wave running or boating in the sun in a tropical island. Tourism does have a role. The majority of people traveling, I think 80–90%, are engaging in some kind of form of tourism, them or their companion. They're in that country for a couple weeks, and they're doing the tourism that their doctor approves based upon their medical condition. So as a facilitator, whether you're starting out new, whether you're trying to organize your business a little better, or whether you are trying to re-energize your business, you have to create implementation guidelines. And I think the most important part is set realistic goals. I think, the reality is that in any business, if you're starting a facilitator business in any business, it's going to take you, no matter what business it is, longer than what you expect. So you have to build that time in there of getting things up and running and getting profitable and build a longer term. And most importantly, set realistic goals. You're not going to come into business today and be sending 100 patients a month next week or next month. You're not going to come into business today and get that big insurance client who's going to be sending you a ton of patients right away. So you've got to create action plans, timelines, goals, and you've got to measure your results. Really look to see what you're doing and if it's successful. And if it isn't, you're not getting ROI, look at, is this something that just takes a long time, or should I switch and try something different? So some examples of realistic goals. is have a well-positioned website. You know, if you're starting, I want a well-positioned website by the end of the year. Or if you're trying to revamp your business, I want a updated new website by the end of the year. I want to visit 5 hospitals the next 3 months. I want this many number of contracts with this many number of hospitals by the end of 2014. I want to service 100 customers by the end of 2014. I want sales of 200,000 by 2016. And I want to employ X number of employees by 2016. So list your goals year to year and make sure that there's something that are realistic and that you can achieve, and then fit within your business plan. Because you don't want to go out and start a business and hire 5 employees and think you're going to cover their expenses right away. So it's not, you're not going to be able to open shop overnight. And because if you're dealing with the corporate market, it's relationship building. You have to travel and meet people. And this can take months and longer, and it's important. There's a lot of external factors. So, you know, the medical tourism industry was booming, and then the economy collapsed globally, and that really slowed it down because there were a lot of insurance companies and employers moving forward with medical tourism. There's competition, there's the quality of the providers, there's contracting, there's a lot of issues. And at the end of the day, it's about the consumer experience. So that's the most important. It's about the positive consumer experience, and the biggest thing that's going to help any facilitation business grow is word of mouth. It's a patient having an amazing experience and telling 10 other people, one of them going, them telling 10 other people, and it's an exponential effect of word of mouth. And you should over-deliver and exceed expectations. This isn't a transaction. This isn't someone buying an iPhone or buying a car. There's a lot of hand-holding that starts before they travel, during, and after. And you can't miss any of that. You know, the aftercare is really important, because what if they have a complication when they go back home, or they have a question, or they feel that once they got back home, you just didn't care about them or follow up with them anymore. And there's a lot of little tricks and things you can do that can streamline and have all these automatic communications and things happening to make sure you have a positive experience. So obviously you need a business plan. You got to identify your target market. You got to identify what's the needs of that healthcare consumer in that target market. I mean, it doesn't make sense to say I'm going after Russian patients, you know, for dental work, for example, if they have great dental work and affordable in Russia, and the people don't want to travel for it. You got to choose the right destinations and partners, and most importantly, you got to market and market and market. I mean, you really have to work hard to build your brand and business. You know, when we say, you know, for this slide, solutions unanswered. Of the recent survey we did, which wasn't a comprehensive, massive global survey, and we're going to release it shortly, but 36% of the medical travelers said they're satisfied with their medical tourism facilitators. So my question is, why is it that it's such a low number that 36% are satisfied? Was it that specific facilitator, or are the best practices and services not being provided? You know, as a facilitator, how do you know what the best practices are? How do you know what all these other facilitators in all these other countries are doing to provide an amazing experience? Maybe, you know, you think you're providing a 100% positive experience. Maybe you're at 36%. Maybe you're at 50. Maybe you're at 75. Maybe you don't realize certain areas that you're failing in because you're not providing that solution. You're not providing that service, you're not providing that communication, or you don't even know it exists. And this is one of the reasons why that we you know, created last year our Certified Medical Tourism Specialist certification program, which I'll go into a little later, is to really educate the facilitators on what are the best practices and standards. Because I think this is a perfect example to say it's not an even playing field. This is not something just easy where you can just provide any service you want and people are going to be happy. And one of the comments that they had in the report was that you know, medical knowledge and availability of them getting a hold of the facilitator and attention to detail leave much to desire. So, you know, there could be some of you on this call who are doing an amazing job and this doesn't apply to you. But I know from a business perspective, you can always improve. You know, and you have to always strive to, how do I improve? How do I measure my success, my results, my customer satisfaction, and how do I always, on an ongoing basis, year after year, look at how I can make it better and better, that patient experience. So I think it's important to enroll in continuing education, always be on top of things. Continuing education, by the way, is not just important for you to be a better facilitator, but it has to do, at the end of the day, with money and revenue. I know a facilitator, who came to our conference. It was, I think, our third one in LA. They met a hospital. They focused on a cutting-edge procedure, and that year sent 500 patients to that hospital. When I was traveling a year, and I would say about 6 months to a year later, other facilitators started to become aware of this cutting procedure and started to get into it. And then a year later, I was over in Asia speaking at a conference and talking at a table with some hospitals and some facilitators and talking about this procedure, and they were shocked, and they're like, what is this procedure? We've never heard about it. And it's like, if this is your industry and this is your focus, how much money has it just cost you not to be in touch with what's going on in the rest of the world? What's a new procedure that's in demand that patients are traveling for? Cost you $10,000? Could it cost you $500,000, a couple million? If this is your business, you need to be at the top of your game, and you need to know what everyone else is doing. And the moment there's something cutting edge or a trend going on, you need to be on top of it too, or you're behind the game. I think it's important to attend conferences. I know it's difficult in our industry to find quality conferences because there's really not, there's not that many quality medical tourism conferences. There's a lot of private conference organizers where they put on 1,000 conferences a year, and anything. It could be electronics, the oil business, and then they pop together a medical tourism conference, and then you go and they don't have good speakers, or there's no buyers, or the buyers aren't really qualified. I know there's a conference last spring where they sent out their buyer list, and one buyer was was under investigation by the Federal Bureau of Investigation. 2 of them weren't even real buyers; they were consultants. So I think it's very difficult as an industry participant to find a quality conference where you're going to learn and you're going to meet quality buyers. I think one of the things that the industry really needs is a lot more research. And we founded last year the International Healthcare Research Center, which is a 501c3 nonprofit research center headquartered in the U.S., focused on transparency and in global healthcare quality, population health management, medical tourism, and consumer healthcare. And so we're going to be partnering with some major universities this year, and we're going to start putting out a lot of research giving insight into how are consumers making their decisions? Why are they traveling? What's their time process for traveling? For what procedures? How much are they spending? But looking at patients in different countries, different regions. So what is that Middle Eastern patient's decision-making process? What's the North Americans? What's the Europeans? And then more importantly, what's their experience like? These are extremely important things that I think provide market intelligence to facilitators so they can kind of customize their business and stay on top of it. Definitely, invite everyone to attend our conference this year in Las Vegas. It should be our biggest event yet, and we're excited because I know Las Vegas is known that when conferences move to Las Vegas, participation increases by 15%. And I know we've got a lot of positive buzz for this year's conference. We're going to have up to 2,000 attendees from over 100 countries. We've really expanded our speakers this year. We're going to have over 100 speakers. And then for those of you who aren't aware, if you're a medical director at a hospital, work at a hospital, we have a medical director summit, so your medical director can apply for a complimentary pass. And then we have our ministerial summit. Our ministerial summit will be in its 3rd year, and our medical directors will be in our 2nd year. We have some really great keynote speakers this year. We have Zappos. For those of you who aren't aware of Zappos, they're known as the #1 customer service company in the United States. They sell shoes. All they do is sell shoes online, but they've nailed it with customer service. And they have amazing loyalty with their customers where they just come again and again, and a tremendous amount of word of mouth. And so they're coming to speak about the culture evangelist. So how do you create your own company culture to make it so that all your healthcare consumer clients and your patients love you? We have the New York Times best-selling author. We have the famous surgeon Marty Makary, who's going to talk about Unaccountable, how to advocate for patients in the hospital. We've got Joseph Grenny, who's Change Anything, help you transform your business, your personal life. We have John Connolly, who's a researcher in medical tourism. We have the Chief Medical Officer for Verizon. This is just a sample of some of the 100 speakers for our buyers. Speakers, we got Dr. Khalil from Afghanistan, Dr. Mail from Russia for medical tourism abroad, Collins from Global Link Solutions in Kenya. And one really neat thing we're actually doing in the exhibit hall today is we're going to have a Meet the Buyers Pavilion where we're going to have a special lounge where we're going to have employers, insurance companies, and facilitators who send patients overseas who are interested in a special area in the exhibit hall, so you can actually network and meet them, which will be a lot easier than trying to schedule a networking meeting or try to walk around and try to find them. If any of you haven't, I definitely recommend to go through the Certified Medical Tourism Specialist program, which was created last year. It's a living and breathing program. It's all about best practices, teaching you how to run your business the best way and deal with patients. It's about transparency. When you sign up, you get 2 years of MTA membership. You get included in the MTA website at medicaltourism.com, and we have continuing education on an ongoing basis. And we have a special right now where you can actually get certified online, become the expert now, get the designation, and then attend the conference and be really prepared. And there'll be a code at the end, and you can save $200. This is for participants of this webcast up through the rest of the month. But some of the real benefits of CMTS is the education about best practices, giving you a professional certification that helps you stand out, being able to tell prospective healthcare consumers and patients that you kind of reviewed by an outside party, have studied, take an exam, and you have knowledge of the best practices. Part of that is how do you separate yourself from a facilitator that doesn't have good practices or best practices. Through the online continuing education we're going to do throughout the year, you can stay updated on industry updates and trends. Some of those things that I was telling you is really important for your business. And being able to network and share with other MTA members and people who are certified. And obviously we're going to be referring patients and others who are interested in sending patients and corporate buyers to work with those who are certified medical tourism specialists. And when you get it, you get a diploma. You can put it on your business card, your seal and everything, and your LinkedIn profile. Your benefits of medical tourism membership, for those of you who are interested in actually just becoming a member of the MTA, increasing networking opportunities, access to patient leads, to our private website for members with research and other data. We have a 2-for-1 registration for our annual conference that members pay the price. They buy one pass and they get a second for free for someone else from your office. And also there's going to be access to market research trends and analysis. I apologize because I realized that the code isn't on here, but if anyone wants to email me for the specific code to register for the $200 off, please just send me an email or anyone in our office an email or Gil. Also, for those of you who are a facilitator or looking to become one, I definitely recommend the Medical Tourism Facilitator book that you can buy on our website or from Amazon. And that's really all about how to develop your business and market, understanding the best practices, looking for a return on your investment, and identifying current and emerging market trends in insurance and dealing with corporate buyers. So that's definitely a good baseline for you to read. And we have membership categories from insurance companies to employers to facilitators, and we're doing a lot of exciting stuff. We're revamping a lot of new benefits, and we have a lot of growth projects we're investing in to really speed this industry up. For those of you on the call, we also look at the MTA for partners in different countries to look at how we can really get initiatives going. So, if you're in a specific country or city, we can get heavily involved in working with you and the government to get the government to support the industry, to try to work with insurance companies and corporate buyers in your country, and to really create a lot more momentum. So definitely, reach out to us for that. This is just another duplicate slide of some of the benefits for medical tourism for members, but you can email Gil or he'll send you information on membership. I hope to see a lot of you at our conference this year. And with that, we are going to shift over to questions and answers. to see if anyone has any questions. We can answer them right now. So feel free to type it in. We're also going to make this webcast available afterwards. So if anybody is looking for the presentation, we're going to make the video available probably in the next 24 to 48 hours. So if you could just give me 1 second, just having a problem pulling up the question box. So, one question came in, and from, let's see, sorry, my question thing keeps moving. Oh, from Ellie, saying I'm the owner of a hospital in Lebanon, and our aim is to grow medical tourism, and what do we need to do? How should we proceed? So that's obviously, I think, an extremely detailed question. I won't be able to cover it in total comprehensive way now. So there's a lot of questions that need to be asked before we can kind of even advise you of what direction to go. Do you have an international patient now, or is it something that you need to develop? Really looking at what are your target markets, where are you looking to get patients from? Is it the Middle East or GCC, Asia, other countries? I think obviously a first easy step is joining the Medical Tourism Association, and we can kind of work with you to go through the benefits and kind of educate you on the marketplace, and really look at what are you trying to do and what are your needs, and then maybe referring you to the right people in the industry that you can work with. Attending our conference and really being able to connect with buyers who might send you patients or other facilitators. But I think there's a lot of questions that we would need answered to really give you the right answers in the right direction. Okay, and by the way, I was just the discount code for that to get the $200 off. I was just passed to me. It is MTF discount. So that's short for Medical Tourism Facilitator, MTF, and discount. And you can use the link that was on the slide. I was trying to get back to the slide here. That's the link right here that you can use to use the MTF discount code. Okay, so I have, let's see. So one person asked a really great question. Alexandra asked, seems like there's a lot of facilitators already out there. Is there a real opportunity for any new entrants? There are a lot of facilitators out there, and I think there are opportunities. It's going to depend on a couple things. One is where are you located? What is your target market? So, there are three types of facilitators in the marketplace now. There are excellent facilitators. There are ones that are good and average, and then there's ones that I would say are very poor. And those poor ones are still getting patients. So I think there's definitely an opportunity to come in and take market share away from the ones that aren't doing best practices. Now, with that, having said that, is this industry is growing. So with this industry growing, there is opportunity. More patients are traveling. We're in a globalized healthcare world where borders are broken down and people are traveling everywhere for care. There's no more limitation anymore. And so with that, as more insurance companies offer this and allow people to travel, as more employers offer this, as more individual cash-paying patients, I think there is opportunity. And you have to look at where you're located and where you would have the best fit, and then determine, do I go after consumers or do I have to go after the employers or insurance companies? But I think there is definitely opportunity, but you have to create the best business practices. You have to have the right business plan in effect. You have to do the right things to make sure you're successful. Because like I said, I don't want to tell you yes, the answer is yes, and you're just, because there's a lot of people I think who've come in the industry in the past who think they're going to get rich quick and they're going to make hundreds of thousands of dollars or millionaires just because they're opening medical tourism and there's all these patients traveling. And you might look at what can I do creative or more unique. Maybe there's a hospital that you want to work with that doesn't do marketing or doesn't have the staff to do marketing, and maybe you want to decide that one creative way to get business would be to kind of be their marketing person and be a facilitator but be attached to that hospital. There's a lot of creative things that people are doing as a way to try to make their business a little bit more successful. One question that was asked are facilitators in the U.S. allowed to handle patients' medical records or allowed to actually forward them to clinics? Well, the answer is yes and no. This is from Arnold in D.C. It depends on the circumstances. So you can get someone to sign a waiver to allow you to handle their medical records. Or if someone voluntarily gives you their medical records, you're allowed to have them. But it's also how you deal with those medical records afterwards. You really should use a secure format to transfer those medical records to someone else. So you are allowed to have it, but you can run into trouble if you do not handle those medical records properly. So one question is, will you have webinars on the effects of the Affordable Health Care Act or any resources you share? So yes, we do webcasts on the Affordable Health Care Act all the time. I did one last week with about 800 participants. So what we'll probably do is update our white paper in the next couple weeks, do another webcast on the U.S. healthcare reform's effect on medical tourism, because I think it's going to drive a lot of medical tourism business. So this question is, what is the average age of the American medical tourist? And this is by Jonathan. So we're trying to gather some more data to release this for one of our reports. So I'd like to wait until we have that data out because I don't have the exact final answer, and I don't want to give an answer that's somewhat inaccurate. And I know also the type of patient also can vary. I know recently we got a Costa Rican dental clinic told us this is the profile of an American patient that we received. This is their average age. This is their average sex. And then a Mexican dental clinic that just looked at those numbers and said this is not the demographic of the American dental patient who's coming to our clinic in Mexico. So I think those numbers vary depending on where they're going and who their target market is. One question said, is there any guidance on how to best charge for services or price a service package as a facilitator? That's an internal decision that you kind of have to make. We cover that a little in our certification course, the CMTS course. You have to determine what works for you and what works for your end client. So whether that's a per employee per month fee for a corporate client or a fixed fee, or you're doing a commission on a percentage. I think you just need to understand the issues I discussed earlier, make that determination, and then I think just be transparent and disclose it. And I think something important to understand for facilitators is there are hospitals that work, very closely with the facilitators, and they protect the facilitators. And then what I mean by that is you refer a patient to go there for care, and you're locked in for your commission. You're going to get your 10 to 15% commission. But there are hospitals, there are some that are cutthroat and have a reputation from it. So if you get a healthcare consumer lead and they're interested in going to a hospital for an orthopedic procedure, and you actually go ahead and send that patient's information to that facility, you go back to the patient, you say, yes, they can do the procedure, here's the price, this is the hospital, this is the doctor. Some of those cash-paying patients will then pick up the phone and send an email and call that hospital direct. And that hospital may actually have a policy that they're going to start dealing with that patient direct and cut you out. So you really have to choose your hospitals right. You might want to add some stuff to your contract. And my definite advice is if you're a facilitator, if you see a hospital do that, immediately stop working with them. And feel free to share it on our Facebook page or LinkedIn because I think it's important that everyone kind of works together collaboratively and protects their interests, and people aren't trying to backdoor each other and just take money from someone else just to make a little bit more. So one question came in from Deborah, is who has the best showcase for medical tourism outside the U.S.? That's a huge question, and it's not a simple answer. If you asked me that question 7 years ago, my answer would have been really simple. You would have heard of Thailand and Singapore and India and maybe one country in Latin America. But right now, it's all countries. I mean, there are over 60 countries promoting themselves for medical tourism, and every country has their own unique perspective. So there could be a cutting-edge knee replacement that you want to send someone to Denmark for, something you want to send to someone for Germany, someone for Thailand, something specific to Brazil. So I think that ties down to is what patient are you dealing with, what type of procedure, and then looking at where to go. Because with 60-plus countries, it's not easy for me to tell you, here's the country. That answer doesn't work anymore. And we've seen a lot of countries lose medical tourism. India, 5-7 years ago, they were known as they're the best, they have the highest quality, the most affordable prices, everyone goes to it. And what ended up happening is I think the Indian government and the Indian hospitals got very arrogant, and they felt they didn't need to market themselves anymore because they were where everyone was going to go. And so what ended up happening is facilitators and buyers would go to conferences, for example, our conference, and all the other countries, all the other hospitals would be there promoting, and they would meet each other. And as I said, this is a relationship-driven industry. No one's just going to send someone all the way around the world for care just because you have a pretty brochure or sent me an email that was the cheapest price. So you've seen a lot of medical tourism that used to or would have gone to some of these countries that were the original 5 or 6 out there, now being diversified all over the world. So the competition has gotten much more competitive, and it means people have to market a lot more. I know one question came in that says, does the facilitator, medical tourism facilitator book give examples of forms that should be used? So the answer is the book does not, but I know that we're adding as a part of membership, language of sample contracts that facilitators should use, and sample provisions that should be in their contracts or their waivers. So I know we're doing an updated version of the book, but whether it's in the book or it gets added to when you go through CMTS, that will be a part of it. And I will give the legal disclosure, of course, that you still need to consult your own attorney. You really need to make sure, because if you have a contract that you're signing with a hospital, you need to take into consideration what law is being dictated. Where are you located as a facilitator? Where's the hospital located? So what law applies? And then for the patient, where's the patient from and what law will apply? It could be the destination country. So you're always going to have variations in your agreement, and you should not just have one strict standard agreement. And really, I would say for the agreements, you really need to be careful that you're using the right contract and legal agreement, because if you're not, then a judge could void that whole agreement. They could go ahead and say, this agreement is not valid. So to give you a perfect example of that, you're a facilitator, and maybe you expect the hospital to do it and they don't. You do not disclose the potential complications for the medical procedure. But they sign the waiver saying, I understand I'm going to, Germany for my medical procedure. I'm going to bring a lawsuit in Germany. German law applies. I know I have very little legal recourse. I'm waiving liability against the facilitator. I'm going to hold them harmless. I'm going to hold the hospital harmless. I understand that I'm traveling overseas to a different healthcare system and hospital. So you didn't disclose the complications. What could happen is, boom, the judge throws it out of court. Why did it throw it out of court? Because there was not informed consent. Why was there not informed consent? You do not disclose the complications that could occur, and because of that, that person signing it didn't have all the knowledge, and so they wipe out that waiver totally, and now the patient can sue you. And I remember a facilitator that's always in the news a couple of years ago, when I asked them, hey, do you have a patient waiver? They said, no, I'm not using one. If you want, I could create one. Patient waivers are easy to use. I think it builds a little bit of a relationship with the patient. And you want them to sign it. We see ads on TV for prescription medication where it says it gives you blindness, it can, cause liver failure, diarrhea. We're used to being inundated with all the complications. So put that in your waiver form and let them know so that you're covered in that perspective. So I'm just skimming through to look for some more questions. We're also going to make a copy of the questions and try to answer them, and put it forward and put it out there. And I know Ben has posted one thing. I know he talked about liability insurance, and he has reminded me, and I appreciate him for reminding me, that Custom Assurance Placements, and they're a member of the Medical Tourism Association, and they'll also be exhibiting at our conference this year in Las Vegas. They provide liability insurance for facilitators. You can also buy complication insurance, which it's a little limited, and there's not that many carriers that offer it, but at least an option you can look into that will cover complications for patients. So with that, I know there were a bunch of other questions. We can't answer them all, so we're going to try to answer them afterwards. Oh, you know, one last question I'll ask is, are there many facilitators that are already medical doctors? And it's a tough competition if there are many of them. And this is by Arnold again in DC. So, you know, there are doctors that are facilitators, and I think there's the potential for doctors to be facilitators in the future. I think you'll see more of them, but I think the real opportunity is also for facilitators to partner with doctors who could potentially refer patients overseas. That is the last question. You know, feel free to email me or call me any questions that you have, and we'll post this later. I really appreciate everybody coming on to the call, and everybody have a great week. Take care.